GERD is an acronym for gastroesophageal reflux disease. It's a problem of the lower esophagus. The esophagus is the tube that connects the mouth to the stomach, and when the lower esophagus isn't functioning properly, the acid from the stomach refluxes back into the esophagus and can cause symptoms and also damage to the esophagus. Well, heartburn can be GERD. A lot of patients have heartburn because acid is affecting the esophagus and it comes across as a burning sensation in the chest. GERD is really a more significant form. A lot of patients have heartburn occasionally. You'll have it occasionally once a month. But GERD really is if you're having it more frequently and you're having a lot of symptoms, then you consider it GERD. So there's some typical symptoms of gastroesophageal reflux disease. Heartburn is one of the typical symptoms, which is burning in the chest. You can have regurgitation. Some people have trouble swallowing where food gets stuck. And there's some atypical symptoms where actually the acid refluxes back into the voice box and into the breathing tube and causes exacerbations of asthma, can cause pneumonias, can cause sore throats, or even a chronic cough and laryngitis. Well, GERD, something that people don't seem to understand or is not told to patients is that patients treat themselves over the counter all the time and they just put it away and they go on with their lives. But reflux can have some very bad consequences, including inflammation of the esophagus called esophagitis. It can cause scarring of the esophagus called strictures, which tighten the esophagus. And it actually can lead to cancer of the esophagus as well. So some of the medical treatments for reflux is, number one, there are lifestyle changes that can happen. And I think most people know that they can avoid certain foods like tomatoes or peppermint, fatty foods, things like that. And they can avoid those and that'll help their heartburn because those are triggers for heartburn. Stopping smoking will help. Losing weight will help. Sometimes patients have more reflux at night when they're laying flat. So if they raise themselves up on pillows, then they will feel better. So that's some of the medical treatments. Then they can go on to medications. There are 3 classes of medications. There are the antacids, such as the Rolaids or Tums. There are the H2 blockers, like Pepcid or Zantac. And there are proton pump inhibitors, like Nexium, Protonix, Omeprazole. And so those are medical treatment for GERD. They're having a lot of these symptoms, they really need to see their doctor and get evaluated because they can self-treat at home, but they really need to be checked if they have any more severe consequences of GERD and get some testing done. Now, if they are being treated with medication maximally and they're still having a lot of breakthrough symptoms or they are having side effects from their medications, then they should be thinking about surgery and go to a surgeon and get a nice discussion about the surgical options and see if they're a candidate. The traditional treatment is called a fundoplication, which is a wrap of the stomach around the lower esophagus to recreate that valve. And it creates a super valve, and it's very effective at treating reflux. There are some newer options out there, but the traditional option is the fundoplication. The newer options include an endoscopic approach to creating the fundoplication. And also, there is a magnetic device that you can augment that valve at the end of the esophagus, place it around the lower esophagus, and that helps as well. Well, there are many approaches to surgery, and the traditional approach is using a large incision. That's what we all have heard about, a large incision with your own eyes. I can do surgery with my hands. But the revolution in surgery has been minimally invasive or laparoscopic surgery, and laparoscopic surgery involves smaller incisions in the abdominal cavity on the abdominal wall and using long instruments to do the entire operation while looking at a video screen. And so patients have less pain. Most of the pain from surgery is from the abdominal wall, and so they actually have less pain with smaller incisions. Endoscopic surgery is actually not doing any incisions through the abdominal wall, but going with an endoscope, which is a camera, down the esophagus and doing the surgery from the inside. And it kind of depends on the surgical option, but these are all done laparoscopically or endoscopically, and so patients do very well, meaning that they have small incisions and they don't have that much pain. They usually stay in the hospital for a night at least, but then they're able to go home and go about their normal activities. Depending on the operation, some may need to be on a special diet for a few weeks, and some may be able to go on to a normal diet immediately.